Good afternoon, everybody. I think we'll get started. Thank you all for being here. And it's a pleasure to introduce our Grand Rounds and our Grand Rounds speaker. And this session of the Grand Rounds is sponsored by the CUNY Urban Food Policy Institute. I'm Nick Freudenberg. I'm the director of the Institute. And I think there are maybe 2 or 3 themes that illustrate both our talk today and our institute and our school. One is a focus on urban environments, and in this case, the intersection between food and urban environments. The second is a focus on equity and understanding the influences, the social determinants of equity. And I think a theme we're developing, and we're very pleased to have today's session to help us develop that theme, is to begin to immerse ourselves in this school in comparative urban analysis, to understand how cities in different parts of the world address the challenges of promoting public health, reducing health inequities, and providing access to health care. And I think our talk today will move us along in that direction. Our speaker is Manuel Franco. He's an associate professor at the University of Alcalá in Madrid and also at the Johns Hopkins Bloomberg School of Public Health. He's the principal investigator of the European Research Council, the Heart Healthy Hoods project, studying urban characteristics in relation to eating, smoking, physical activities, and alcohol consumption among the primary determinants of non-communicable diseases. And he's also the PI of the participatory project on food in cities, which is a Photovoice project that he'll be talking about today. Dr. Franco trained in medicine both in Madrid, Spain, and in Berlin, Germany. And as a Fulbright scholar, he joined the Johns Hopkins Bloomberg School of Public Health to obtain a PhD, and he also did a postdoc working in the multi-ethnic study of atherosclerosis in the Department of Epidemiology. He's published more than 60 peer-reviewed articles and written several book chapters, and he's also the PI of a variety of international projects. And we welcome you, and thank you so much for joining us today.
Thank you very much, Dr. Freudenberg, for the introduction. Thank you very much, all of you, for sharing this evening with me and with our project. It's an incredible pleasure to be here. I was here 5 years ago when this project was starting, and now everything changed. I'm a bit older, of course, and you are working and living in a fantastic building and have a brand new school, and so it's a great start, which I hope that we will continue collaborating thanks to a memorandum of understanding that we have with the University of Alcalá and CUNY, and this has been already very productive already with the students from us coming here and faculty from you guys coming to Madrid. So I hope this is the beginning of a long friendship, like the good films. So today, instead of telling you all of the stuff that we have been doing at the Triple H, the Heart Healthy Foods project that started 5 years ago, I will focus on food, thanks to the CUNY Food Policy Center. And I will try to share 2 main pieces of this project. One is, how do we understand food environment in relation to diet in Madrid, how that relates to a city, fellow city or a sister city from you guys, Baltimore, where I used to work and study, Baltimore. And then I will focus on this participatory action research project, Photovoice Villaverde, which I think gave us a lot of input on how to improve food and diet in our cities. So I'm not only a researcher, I'm also a teacher, a professor at the university, both in Madrid and Baltimore, so I have a lot of questions, and these are my first questions to you. So all of you do public health research in cities, so we have to think about where do we live? Where do you live? Do you live in a city? Do you live in a suburban area? Do you live in a town? Do you live in a little town? Do you live in a place that gives you opportunities for maintaining a healthy diet or being physical activity or being physically active, or does it a place reflect or affect you if you do smoke or you don't smoke, or if you want to quit? We also do a lot of research on drinking and drinking in moderation or not drinking. So how this place of where you live relates to these behaviors. And not only from a perspective of what are the resources for these type of behaviors, but also what are the social norms of people around you in relation to food. And this, for those of us that we are happy enough to be moving a lot around the world to different cities, we know how different those social norms in relation to, for example, eating, which is what we are focusing today, are. So you will see a lot of maps and a lot of pictures of Madrid. I'm very happy to see a lot of faces of people that have been to Madrid. I know from Madrid that will come very soon to Madrid. So this is the municipality of Madrid, which is a city of 3.5 million people. The metropolitan area is larger, but we focus on the heart healthy foods on the municipality of Madrid. And all those dots are the primary healthcare centers that work with us in the Heart Healthy Foods project. So from the very beginning, we were very interested in how to communicate all this research that we do on urban health in Madrid, how to communicate about that, and how to portray this in an easy way to the population and also to policymakers. So one of the first things we did was to hire a great photographer and to do this photo essay studying city life in population health. And I'm going to give you a couple of pictures of Baltimore and Madrid of those things that we think that are important for food environment. In this case, what you see is the fruit and vegetable stand in one of the highest income neighborhoods in Madrid. In Madrid, we love bars and restaurants. You do the same here in New York. Don't think that we are the only ones that we are like that in the world. And this is the median income neighborhood in Madrid. It's called Las Ventas. It's close to the bullfighting ring. And this is what a normal day looks like in the city of Madrid in this neighborhood. If we go to a low-income neighborhood in Madrid, this is Villaverde, where the Photovoice project I will explain you later. This is the way that families spend their evening when they have the chance to have the evening off, and they go with their children to the park for, again, enjoying, in this case, some things. Well, this is Inca Cola and chips. Well, today you asked me about comparing and thinking about Baltimore and Madrid, and this is back in the days when I was starting my dissertation in Madrid. This was published in the Journal of Epidemiology and Community Health. You come from a community health school here in New York, and this was one of my pictures and publications when we were mapping and going into the stores of the city of Baltimore and understanding what those food stores relate to food availability and therefore to diet in Baltimore. The same we did with this is one of the closest food stores to the School of Public Health, and this was a publication in the American Journal of Public Health telling what is inside this store, where we went and measured, again, healthy food availability. We interviewed the store owner, we understood what those stores look like, and we would try to understand and give context to the neighborhood where the School of Public Health in Baltimore is. So when dealing with urban health, inequalities is a fundamental piece of what we need to understand, and I think CUNY is part of that research where you guys are focusing on health equity and health equality or health inequality. So. Friend of mine, colleague of mine, Usama Bilal, and myself, with Dr. Richard Cooper, when Freddie May was shot in Baltimore, we wrote this piece, this op-ed for El País, which is like we want to think that it's like the New York Times of Madrid or Spain and the Spanish-speaking media. But we were talking about inequalities in our cities. Well, you probably know that the life expectancy gap in neighborhoods in a city like Baltimore, which is a small city, can be up to 18 years. The life expectancy gap between neighborhoods by income in Madrid is 7 years. So from 18 we go to 7, but there's still a big gap in the life expectancy. And you guys in the United States have a lot of research on those differences, on those inequalities, and that's something that we fundamentally research and ask, why can that happen? What can we do to reduce these inequalities? Where urban health, food can be part of that for sure. We just published a month ago a statement for the report, the 2018 report for the Society of Epidemiology and Public Health in Spain, talking about what kind of research, what kind of connections we should have in order to develop new neighborhoods and health agenda that really reduces health inequalities or that improves population health. So this is central to what you do here at CUNY and central to what we do in Madrid. So part of the why do we do urban health research is because, as you probably know very well, the projections of the demographic projections for the whole world, not just for Spain or for Europe, is that we will move more and more into cities. Actually, by right now, it's 80% of the population in Spain live in an urban area, and that means that the challenges of aging and chronic diseases in our cities are in front of us. So if I work as we do in Madrid with the primary healthcare system, all what our colleagues at the primary healthcare system do is dealing with chronic diseases and the challenge of aging. Again, urban health inequalities are very clear when we talk about cities, but also cities offer the opportunity for doing structural changes or structural interventions that may improve population health or may reduce health inequalities. And that's what we published at the beginning of our project with Dr. Ana Díaz-Urubo, again in the Journal of Epidemiology and Community Health. And for that, we need to learn novel methodologies. We need interdisciplinary teams, as the one that you have here at the CUNY Food Policy Center. And we need to be very aware that this type of research may be very closely related to action and political action or policy action or policy recommendations. And that's what led me and us to ask to the European Research Council for this project, which was titled Social and Physical Urban Environment and Cardiovascular Health, the Much Needed Population Approach, coming back to Jeffrey Rose's idea that in order to prevent diseases, chronic diseases in this case, we need to have a very clear idea of the context of where our population lives and how do we behave as populations. So I was lucky enough to receive this big grant from the European Research Council, which is the top agency research in Europe, and that gave me the opportunity to put together a team of young researchers that we've been working for 5 years, trying to understand what are the social and physical environment in terms of tobacco, alcohol, food, and physical activity that relates to cardiovascular health in the city of Madrid. I was trained in Johns Hopkins, specifically in social epidemiology, and social epidemiology deals very directly with urban health and relates to the social determinants of disease, but very importantly, what social epidemiology does is trying to understand and bring those social sciences methodologies to public health for population preventive approaches. And again, in Europe, the first cause of death is cardiovascular disease, and the prevalence continues increasing, so is an enormous public health burden for us. So for that, we put together the Heart Healthy Hoods project, which mainly what we try to do is to understand what is the city-urban environment in terms of tobacco, physical activity, food, and alcohol again. And here, these two colors, what we try to divide or to understand is that one thing is what are the resources, the physical environments related to any of those domains. But also, very importantly, we need to understand what are the social norms, or what is the social environment in the different neighborhoods of Madrid in relation to chronic diseases, behaviors as individual behaviors that we all know pretty well. So the secondary objectives of the Heart Healthy Hoods very interestingly included to have this sociological perspective, meaning a qualitative approach to understand the context and the meanings of the urban environment in relation to cardiovascular health. But also trying to push the idea that we need to understand and know better and very well how to measure our neighborhoods. Neighborhood measurement in terms of food, in terms of physical activity, in terms of alcohol, for example. We didn't know anything about alcohol in the city for the last in the last years, and this is something that we are developing more and more and more. Also, because of my affiliation to Johns Hopkins, we thought that it would be very interesting to understand those differences between what is going on in one city or in different cities in the United States and European cities, in this case, Madrid. Also, very importantly, we thought that all this scientific evidence, all these results, or all these papers and articles that you all read in our daily work, we will need to communicate not just to researchers, but also to the general population and policymakers. And that forces us to use different ways of communication, different ways of disseminating, and that's something that we have tried the best way we can, and I will show you some examples of that. For all this, it was very important that to put together an interdisciplinary team that Dr. Luisa Borrell was able to see live working in Madrid with us, where many of us come from the geography point of view, urban geography, in different places. University of Alcalá, Edinburgh, London School of Hygiene and Tropical Medicine, but also we have a lot of sociologists in our group, coming again from Salamanca and also from Johns Hopkins, epidemiologists, but also photographers and journalists and people who work on citizen science. Actually, one of my colleagues that started this project with me and helped me to put it together is a journalist that went to Stanford, then to Miami, and now works here downtown in New York. He was fundamental to put this project together at the very beginning. And of course, in the very middle is the primary healthcare system, where we collaborate on a daily basis with the research unit in the city of Madrid to understand what is the situation of cardiovascular health or chronic diseases in the population of the city of Madrid. So this is one of the worst photos that I will show you today from a quality point of view, but this is the best photograph that I show you today, because this is where all the human capital is, and I'm very proud to say that this was September 2014, and most of these people are still working with us, besides 3 of them that fell in love with different people around the world. And against that, you cannot do anything but wish them best of luck. One is happily in love in Baltimore, the other one is happily in love in Paris, and the other one disappeared in Thailand. So against that, just best of luck. The rest, we keep on working a lot in Madrid and doing the best we can in terms of urban health research. So again, this is the municipality of Madrid. Madrid is divided in 21 districts, 128 neighborhoods, and what we call census sections. Out of that, 1.4 million people are aging between 40 and 75 years old, which is what the age span that we are interested in the Heart Healthy Hoods study. So that's the why do we do the Heart Healthy Hoods, where do we come from, and now we will focus on food and food systems and food environments in relation to diet, or Mediterranean diet in Spain. And this is the interest on food systems and food environments is not just an interest from us or from the EU. It also brings a lot of interest in the US, of course, from you guys, but also from the Center of Livable Future in Hopkins, also on the, for example, on UC Davis, where I was able to visit them and work with them. But also the FAO is extremely interested on food systems and how food systems finally relates to your individual diet, relates to your health outcomes. And this is a fairly complicated slide on what the food systems nowadays look like and how this food system relates to sustainable development goals. And this was just published last year with the input of a colleague of ours in Johns Hopkins. So food environment and food in the cities was not something that we regularly were taught or understood or thought about it in nutrition. Actually, this is one entry chapter that we wrote with Julia and Usama for the Encyclopedia of Food and Health. And this encyclopedia has been for 12 editions. And this is the first time that this encyclopedia included food environments. I'm sure that the next edition will include food systems. So that's to show how really environments or city environments are coming into the world of research nowadays. So now what I will do is to show you some of the publications that we've done in Madrid. This was published by Dr. Usama Bilal, and the idea in this analysis, part of his dissertation, was to look at neighborhood changes, neighborhood social and economic changes, and how those neighborhood economic changes relate to the changes in the food environment in the subsequent years. And for that, what we did was a complicated ways of understanding how neighborhoods change in the city, and this is what you see here in the different types of neighborhoods. So we develop a matrix and a definition of changing neighborhoods in terms of neighborhoods that were decreasing in their income or in the population income living there, neighborhoods that were increasing in the income, neighborhoods that were gentrifying, and neighborhoods that were aging in this period of time. And then what we looked is how those neighborhoods related to the amount of supermarkets, specialized food stores, or fruit and vegetable stores, and how those, what is the proportion of those stores over the total number of food stores. So what you see that food stores tend to continue increasing in the city of Madrid, and only some specialized food stores or fruit and vegetable stores are slightly decreasing for those neighborhoods in the category of increasing SES, because that's where most of the supermarkets were increasing in their numbers. But in general, in Madrid, the number of food stores continue to increase, regardless of the type of neighborhood changes. So, in conclusion, and that was something that was very disputed in the literature of food environment, is how food environment, or how fast food environment changes. So in general, the overall number of stores increased over time in Madrid, especially for supermarkets and also other unspecialized stores. Changes varied by neighborhood type, and this overall increase in food stores, including unhealthy food stores, probably relates to this phenomenon of food swamps, where when I started all this research in Baltimore, we started coining and thinking about food deserts. Now what we tend to think is that it's not so much about food deserts, especially in cities like Madrid or New York, is areas that are what we call now food swamps, where you have everything in your area, and then you need to tease out what different populations are doing in terms of different, not just from availability, but maybe from prices or education or something else. The next set of results that I will show you was published by Julia Diaz here, and what we did was to compare Baltimore to Madrid in terms of the local food environment, comparing two completely different cities in two different countries. And what you see here, this area in Madrid, is what we call the median neighborhood. So this is a neighborhood of 15,000 people. That is not, these people are not rich, are not poor, are not highly immigrant, are not all Spaniards or born in Madrid. And this is not a very dense population. This is not a low-density population in the city of Madrid. And this is the same area in Baltimore. And then what we did was to identify all the food stores in the area, go into the food stores and see how many of those food stores have fresh fruits and vegetables, which is what we recommend, or the basic recommendation nowadays in nutrition. And what you see here is that in Madrid, 77% of the population living in that area had access to a store that carries fresh fruits and vegetables within 200 meters, versus 1% of the population in Baltimore has access within 200 meters. Vice versa, none of the Madrid people living in that area were further out than half-mile, and 82% of the population in that area in Baltimore were half-mile from the closest food store. So another way of looking at this data is what are the density of food stores carrying healthy food availability, healthy food meaning fresh fruits and vegetables. And what you see here is that there's a myriad of stores in the city of Madrid as compared to the city of Baltimore. Actually, the density of food outlets per 1,000 residents is 5 in Madrid versus 1.6 in Baltimore. For those of you who have lived in Baltimore or have spent some time in Baltimore, this is the reality of, in this case, the median neighborhood compared to the median neighborhood in Madrid. And again, this is the idea that comparing cities in terms of one very important piece of health, which is food environment, gives us a lot of clues of what's going on in those cities, and also clues what to intervene or to carry research on. In this case, what we see, and not only in this analysis, but also in a lot of qualitative analysis, is that relying on specifically on supermarkets underestimates healthy food availability, because in Madrid, a lot of small-sized food stores carry a lot of healthy food options. Also, the fact that the food environment, the urban environment in Madrid is highly walkable. Actually, it's very difficult to do your grocery shopping with a car in Madrid, and now even more difficult because of the current policies against air pollution in Madrid will be almost impossible. So those highly connected food environments are highly walkable, and those are especially interesting for populations that not necessarily have a car or use a car. When we, for example, when we think about aging populations or elderly populations in whatever neighborhood, in whatever city. So these were 3 sets of results of how food environment relates or look like in Madrid and Baltimore. And I would like to stop here for a second, maybe get some questions before we move to the next project carried on in Madrid, which is a very different project because it's a participatory action research project that changes completely the type of methodology and the type of results. So, any questions or ideas? Yes. Sorry. Yeah.
You answered this already. Why did you compare Madrid to Baltimore versus New York? Because, like, in New York, it seems much more, I guess, comparable. That there would be walking distance to a lot more fruits and vegetables, and maybe only in certain neighborhoods. So maybe comparing a similar area in Madrid to that similar area in Manhattan. And so would Barcelona, let's say, be closer to Baltimore in terms of access to fruits and vegetables versus New York?
Yeah. Well, why we did Baltimore and Madrid, that was because I am continue working in Baltimore as a faculty member, and because the city of Baltimore, after I did my dissertation, decided to complete the food store mapping in the whole city, and we had a very good data set on what is going on in the city of Baltimore that we could compare to Madrid. Your question comes very handy. I would love to do comparisons between Madrid and New York because I think there will be a lot of differences, but probably less than Baltimore, and probably different research questions will come to place when comparing New York to Madrid. We didn't have this when we conducted this project. We didn't have the connection to CUNY that we have nowadays, and we hope that we will probably or hopefully do these type of comparisons in the near future. More questions or?
Regardless of the connection, it's obvious that this is an opportunistic comparison based on what was available. But how can this comparison be used? How is it useful since it is not contextualized within the socio-political and economic environment?
Yeah.
I'm not exactly sure what we learn from it in terms of Madrid has better access to healthy food.
Yeah, well,
that's interesting. But
yeah, well, I think one question would be, how about if somebody in Madrid does not have a healthy diet? Why does somebody in Madrid does not carry a dietary pattern that is the Mediterranean diet? Because actually they do have it 200 meters away from their house. So then the question is, well, maybe it's not food availability. It may be something different. So that's another way of understanding that the answer to the question. The other thing that we can learn is that what is actually driving the fact that Baltimore looks like that and Madrid looks like that? Why is the reason that Madrid is like that and Baltimore is like that? Actually, different areas in Madrid may look like Baltimore. This is the median neighborhood in Madrid compared to the median neighborhood in Baltimore. If we go to extreme neighborhoods within the city of Madrid, this may look like that. And for example, what comes, another important question or related conclusion about that is that one of the reasons why Baltimore looks like that is because of car ownership is kind of mandatory in Baltimore if you want to have a healthy diet, which is what we want for our populations. So what if you are a kid? Or what if you are a person that is 90 years old in Baltimore living in that area? Or what if you don't have a car because you don't have the money to have a car? I mean, these type of comparisons are difficult, and now we are developing a matrix of how to compare cities with each other, not just focusing on one specific neighborhood, but focusing on different neighborhoods that represent one specific city. Yeah.
One of the observations from the cross-city comparisons that I've done is to get insights into the role of governance and the different roles of both municipal and national governments. And I wonder if you have observations from this study of how that played out in Baltimore and Madrid.
Yeah, that's a very good question as well. Actually, Baltimore is a city that is more worried and is doing more action or carrying more actions into food policy than Madrid is. Baltimore is a city that within the city health department has appointed a food policy person and a whole team within the city and carries food policies and interventions that I think are more advanced than we have in Madrid. Probably the reason for that is that the situation in Baltimore in terms of food is way more worrisome than it is in Madrid. So that's also truth is that the trends in terms of food policy, and you know that better than me. For example, the Milan Urban Food Policy Pact came like the last 5 years, I think, or 6 years. So now more and more we are starting to think that cities need to have policies in place to improve the food environment and therefore diet of our populations. So I think city comparisons are very difficult, but at the same time, I think that they give you a lot of hints and ideas to further to more, not just research, but interventions to improve diet, which every city needs, not just Baltimore or New York, but also definitely Madrid, because not everybody in Madrid has a perfect diet by any means. More questions related to what I presented so far? Yes.
I'm curious about how you're measuring the impact of food policy on health, and I know very little about Baltimore, but about Madrid, but I've studied Baltimore a fair amount. And my understanding is that the huge more than 18 years has a lot more to do with premature deaths due to gunshot wounds and due to overdoses than it does to other health effects, because you've got a huge skew. So I was just, how are you sort of screening those types of premature deaths out in terms of measuring what the impact of food policy is?
Yeah. Well, health inequalities within a city are worrisome, are a public health issue in any city. Again, Madrid is 7 years old. Barcelona is 8. Barcelona just released a report showing that they're reducing health inequalities in terms of life expectancy. What drives life expectancy in a country or in a city is a big question that nobody I guess is ready to answer 100%. What are some pieces of those differences? Probably crime is one of them, or homicide is one of them, but not all of it is that. And then the question is, what can we do from a city point of view or from a research point of view to reduce those inequalities? So definitely the urban environment will play a role on that. And actually there's some very interesting research in the United States that Baltimore, Detroit are the ones who have the largest gaps, but New York, for example, or San Francisco are the ones who have the smallest gaps, although those gaps continue to be 9 years, for example, or 8 years. So. No, we are comparing the city of Baltimore and the city of Madrid. So those were municipalities both. Yeah.
Besides the difference between Baltimore and Madrid, and I understand that you start in Baltimore because you are still legal and have an opportunity to do research, which is wonderful, and also you have an opportunity in Madrid, which is wonderful also, and you can have influence and make difference. But beside the food, I would like to know the dynamic of the city. The dynamic of Baltimore, with a lot of crime, with a lot of broken families, with a lot of low income, many people, is not only about the food. I mean, the gap of the life expectancy is going to be the dynamic of the city. The dynamic in Madrid is different, and of course, if you compare the poor neighborhood in Madrid with the poor neighborhood in Baltimore, it's going to look alike. But besides the income gaps and besides the thing, I think the life expectancy and many of the diseases is going to come in from the dynamic that we have the city. In Baltimore, it's going to be huge.
Yeah. Well,
I don't know if this is going your project, and my question is beyond your project.
Yeah.
That we are talking about health. This is an important piece.
Yeah. And I think that again, coming to that is of course, the social determinants of health will explain the social determinants of life expectancy inequality. But it's also true that nowadays in every city, and in New York City it's also like that, like in Spain, like in Madrid or in Barcelona, what we are seeing is that people in low-income neighborhoods get the same diseases as us, besides if you get killed by homicide. But you get the same diseases, but you get them 10 years before. So you get the same diabetes and you get the same myocardial infarction, but instead of getting it with 80, you get it with 70. Instead of getting it with 75, you get it with 65. So those are again, some part of the explanations of what are the life expectancy gaps or what are the differences in health inequalities in cities. So nowadays, most of the cities and most of the countries in the world, we are getting sick and we are dying from non-chronic or non-communicable diseases. The question is, do you get them? When do you get them? When do you get diabetes? When do you get hypertension? When do you get cancer? When do you die? And that's the main reason of the differences in when comparing neighborhoods across cities.
I just looked up the Department of Health report for Baltimore for 2017, and in fact, the highest cause of death is not gunshots or even drug use. Those are actually like 5%. The vast majority of deaths are health-related, so I just wanted to clarify that.
Yeah, thank you.
Hi, thank you very much. So I really enjoyed the maps of the median cities in both Madrid and Baltimore. I was wondering how you adjusted not only for physical access, but price accessibility. So if you can I had the opportunity to also live in Baltimore City, and my closest grocery store, I had to walk to the Whole Foods through a housing project. So those people do physically have access, but not price accessibility.
Yeah, that is a fundamental question, which comes handy to what I will explain next. Is one thing is your distance to whatever your physical resource is. In this case, let's say healthy food availability. The other thing are the social norms. Is the acceptability of whatever norm to access that physical resource. So in Baltimore, it was very clear that when urban renewal started to happen in the downtown area, in the harbor area, there was a huge urban renewal bringing very fancy stores. Even if you would give away or you would give fresh carrots away, nobody in the project 3 blocks away would go and get them. So these are questions that will not be answered just doing geospatial analysis on a Euclidean distance. You're going to need to understand what are the social norms and what is going on the acceptability of one behavior versus the other, and how is the acceptability from the rest of the population. So that's what makes it very complicated, but also fascinating in order to run interventions. Okay, so what I will explain and show you next is the Photovoice Villa Verde project, which is a participatory action research project that we carried out in an underserved area of Madrid, with the idea of how residents in Madrid will provide us with new knowledge to improve food environment in a city like Madrid. Probably some of you or most of you might know what Photovoice is. Photovoice is a methodology that was developed by Wong and Beres in the 90s in University of Michigan, coming from the world of social work. And this research methodology, what does is enables people to identify and reflect their community's strengths and concerns about using photography about one specific topic. In this case, the topic was food environment and diet or health-related outcomes. So our main objective was to carry on or to conduct for the first time this type of project in a low-income area of Madrid, aiming to understand how the local food environment influenced individual diets from a resident's or citizen's point of view. And for that, we worked very closely, or we ran this project together with the City Hall and the Public Health Institute of the City Hall, and we worked in 2 administrative low-income neighborhoods within the district Villaverde. So this is the city of the region of Madrid. The city of Madrid is in the middle of the municipality, and this is in the south of the municipality. These are the two neighborhoods. So we invited participants. We invited in each of the neighborhoods, we invited groups of men and women, of groups of 6 to 8 people to participate in this project. And you have all the participants here from San Cristobal and from Los Rosales. And these are all the people that work with us. This is our team, and this is the team of the Public Health Institute, the City Health of Madrid. And I'm showing this and this because you see how many people participated and how many researchers and collaborators we had, which is the same amount. So this is a very intensive project that deals with 2 communities that we split it from by gender. And what we did is during 5 to 7 group sessions, 5 if the group works very well, that happened in Los Rosales, and that happened in the group of men and women in Los Rosales, but definitely didn't happen in San Cristobal, which is the most underserved community in Madrid. And actually, the group of men that I was the person in charge of the dynamizing this process, it took us 7 sessions instead of 5. Maybe I was not doing it very well, or maybe men, we have more problem than women to get things done in a properly time basis. What we do first is the photograph. The photographer gives you a camera, a digital camera in this case, and shows you how to use it in a proper way. And then we start sessions by sessions, bringing all the photographs that these people take in their communities, and discussing those photographs and analyzing these photographs in those sessions until the last moment, or the last session, when they discuss what are the main topics or what are the main themes that explain food environment in relation to healthy diets in their sessions. So here you see one of the group work on the final sessions. So all participants took altogether 163 photographs and identified 30 categories explaining that relationship between the food environment and healthy diet. And then we put them all together, and researchers in our team summarized them into 5 general themes: eating in moderation, cultural diversity, the relevance of food stores, social relationships, and how economic crisis and poverty are shaping nowadays what we eat in those underserved areas in Madrid. And I will show you some of the pictures of all of these themes and some of the verbatims that these participants gave us. So it was very clear from the very beginning that these participants had a very clear picture of what is healthy, what is unhealthy, and how unhealthy food surrounds us, and how it's up to us to eat in moderation or to constrain ourselves from getting what is out there. And here is a delicious dish of chorizo. This is the title of this picture that these participants gave. This participant is 69, and he was saying, on a daily basis, what I like the most is go with my friends to the bar and spend a couple of just a little bit of time, a couple of days a week in there. And what I have is this delicious dish of chorizo. And when I see this possibility, I think about my nurse, I think about my cholesterol, I think about the statins that I'm paying. What do I do? Do I get it? Do I don't get it? Do I say, well, it's just a day and I'll get 2, or maybe not? So that's the same thing that she, in this case, Saskia, she was saying that every day it happens to her when she passes by with her kids from school, and she has this bakery that nowadays in Madrid is ridiculously cheap, and you can buy so many low-quality croissants that you can feed your family for a week with $5. So again, her question is, should I moderate myself? Should I moderate my kids? What do I do in front of this food swamp of possibilities that are very cheap and very unhealthy. Another theme that came out all the time is cultural diversity. And cultural diversity not only means that I go to the stores or to the market, to the farmers market that you said is here on Tuesdays, and I encounter food that I don't understand because it comes from another culture. Is my own culture, tortilla de patata, is part of what we can buy and consume on a daily basis. But also, for example, kebab or pizza or hamburgers, and no Americans or no Italians or no Turks live in these areas of Madrid. But nowadays we have all these possibilities that relate to a cultural diversity of food that is what surrounds us in our cities. Again, this idea that food stores shape what we buy and therefore what we eat. And again, in Madrid, as you saw before, the amount of different food stores that are in our neighborhoods is very large. They were talking about the fishmongers. They were talking about the weekly market. Why do we like it? Why do we go there? Or how those relate to what we eat. The relevance of social relationships. How do we, when we get social, when we get together, what do? We do eat or we do drink. And that's the way that we have organized our social relationships, not just in Madrid, but in any other places. And here it was very interesting. This is a workshop for older women, and they said this is a sewing workshop, and they said, well, we don't go there for the sewing. We go there because we have coffee and pastry with my friends. And they could care less about what was the purpose of the workshop, but it's the fact that we go there and have this eating process. How the economic crisis and poverty shapes what we eat. That was very clear in all four groups, and that was extendedly explained and talked about it in these groups. This is the photography of a food bank in Madrid, and this is one person picking up what is left after the market. So those were the main themes that is published. It's also on a photo book that is available in our webpage. Then the next publication, which we were discussing before in our meeting with the Food Policy Center people, is what are the differences between what we address and measure in a city is from a purely geospatial analysis point of view or directly measured versus what are the perceptions of the residents in a city specifically to the same theme. And this is what Julia, again, with this data, looked at. If we, in the same manner or more sophisticated manner of what I did for my dissertation in Baltimore, is I go to all the stores and I map what are the good stores and the bad stores, and then I map the distance or walking distance of what is available in the city. Okay, that's one way to understand food environment. But the other way of understanding food environment is what do people say about those places of the residents of that area? And actually what we saw is that the residents' life experience was very different from what we get if we do just geospatial analysis, GIS-based objective measures in stores or even store audits. Because while supermarkets have scored, for example, this is one example of those results, supermarkets have scored very high in terms of healthy food availability. Residents preferred more small businesses. And that's a preference, but also, again, that's something that is necessary, for example, for elderly people. So residents captured those social influences that were not tangible or not understandable when we did geospatial analysis, for example, in this area. So one of the most important urban health researchers in the world comes from Australia and does a lot of work on urban health research and livability in cities. And she published this quite provocative paper saying, well, there's two types of research. One that is non-policy relevant, and one that is policy relevant. And when we do policy relevant research and papers, then things get more complicated. This is the non-policy relevant, this is the policy relevant, because we need dissemination strategies, we need advocacies, we need to take it and bring policymakers into account, because we need to have different strategies, etc. Those of you who work in the world of health policy or local policies, you know this is the reality. Sometimes researchers, we do approach or we get closer or not to those type of processes. And this is again what we were saying in our paper, that bringing local residents into this equation, into these processes, is fundamental to develop interventions that really may reduce health inequalities or improve population health. And for that, with the Photovoice project, we developed a set of dissemination and communication strategies that not only included publications, but also included photo books and citizen science meetings and videos, exhibitions, etc., that would involve those participants, talking to the media, talking to the policymakers, talking to bringing this into attention in the city of Madrid. And this is a radio show that is on the weekends in Spain. 3 million people listen to this. This is like the NPR for you guys. This is the most important radio show in Spain. They invited me for portraying about the project, and they say, why don't you bring the participants? And then I thought I will have my 15 minutes of fame. I called my grandmother, my father, my mother, my cousins, and what happened? Well, they didn't interview me. They interviewed them. So my 15 minutes of fame were reduced to 5 seconds, but they were talking and they brought their books and they brought all the results and they explained how they took part of this process and they brought the results of this project to the most important radio show in Spain. So another publication of set of results was this methodology we run for food, but we run another one for physical activity. So we finally put them together, and we put them together with the local policymakers in this area, and we developed a set of recommendations for obesity preventions that had to do with the physical environment, with the social cultural environment, and with the political and economic environment of this district in the city of Madrid. Another very important consequence or consequent paper of this project is from the perspective of the participants. How much participants get out of this process? Is this a positive process or not for citizens getting involved in scientific research? Well, this is what we did with the help of our team and a medical anthropologist that came and worked with us for a year, and we looked at the individual empowerment process that female or women in this process got by the fact of working on the project. And here just a couple of verbatims. It says, you learn from everyone, obviously, and it does not mean that I was right. Maybe they brought me around to their own terrain because we talked and discussed about it. So Photovoice is not just about what one participant during 3 months was portraying and thinking and acting as an activist of their own neighborhood. Is how do we do it from in a group, and how do we all together come with these final themes, come with this final set of ideas and recommendations. So all this is available on our photo book. And one last part that we did is we brought all the participants into a cultural center in Villaverde, in the area where we worked, and we went to the stage of this cultural center, to this theater, where we brought all the participants and 3 of us in the researchers to the city health commissioner, to the district elected person, and to the Public Health Institute director of the city of Madrid, and they discussed all together for an hour what were the main results and main recommendations that these participants came out with to improve the food environment. And it was very interesting to see how some political members or how some technical members of the city of Madrid were ready to take action on some recommendations or not, and who really engaged into the conversation. We had a set of videos explaining the project, and it was very interesting that at some point, because I got this funding from the European Research Council, European parliamentaries from Spain sitting in Brussels heard about the project, and they said, well, why don't you come and bring one of the participants, one of the technicians in the city hall, and yourself and the photographer, why don't you come to Brussels, which for you guys is like well, I don't know if it's the White House or the House of Representatives that last night you were voting, all of you, but one of them, well, the main place where European policy is done. So they invited us to present the citizen science approach in Brussels, and that's what we did in the European Parliament in May. And I was able later on at the European Commission, which is the other house for you, at the European level, to discuss what is the interface between research in terms of food and what is the interface with policy in terms of food, and how this citizen science can really bring some new knowledge to this need. We also included interactive cartography that you can see in our webpage, which is just mainly a map where you can click and see all those pictures, but also you can listen to the. Of course, this is not translated into English. The video is translated into English in subtitles, but not this cartography. Okay, and that was the second part of what we did in Madrid from a citizen science point of view or participatory action research point of view. I would like to acknowledge all the participants in this project, not only in the Photovoice, but also in the cohort study that we are running, all the Madrid team and all the collaborators, and of course all the funding agencies that include the European Research Council, but also the City Hall and the regional government of Madrid, another national research funding that we got, private funding, and also funding from Johns Hopkins. And on behalf of all the team that actually is the ones who carry all the work, or most of the work, I also do some work, we developed all this, and what I presented to you is a piece on food that may be relevant to you guys. Thank you very much.
Hi, can you talk a little bit about some of the policy recommendations that came out of the Photovoice project? Yeah, they came out with 12 policy recommendations, and we ranked them with them in terms of how much time would it take to bring them into place, how much money do they think that it would cost to bring them into place, and how feasible for the local policymakers are those policy recommendations. And the first ones that they came with related to the availability of foods that relate to people who already have diseases, like for example diabetes or hypertension. How people in those underserved areas do not have a lot of activities or possibilities to do something else besides eating not very healthy food and not being physically active. So that meant that just drinking and eating poor, low nutritional value foods. And for example, one thing that ranked very, very high on the recommendations is the fact that those food banks that existed around this neighborhood, nobody knew where do they come from, who organizes them, are they providing healthy options or not, how to improve those And then one of the main things that the local policymakers said is that, well, it will be very easy or feasible for us to do a map of who is offering those food banks and try to improve try to improve the fact that, as you saw in the picture, all what you get in those places is canned food and dry food. So if the city hall was able to bring facilities to bring fresh foods for in those food banks would be an interesting thing to do, and that's what they one of the three that they picked from the participants' point of view. We also did policy briefs to bring them to the local policymakers. At the end, the city was interested in this, not just the districts, and we brought them also to Brussels. And very interestingly, some of the recommendations also related to food waste, for example, something that is very high on the hierarchy of policies in Europe right now, how to reduce food waste. Yeah. Well, more than restaurants or takeaways or restaurants as we understand them here in the United States, is they talk about bars and places to hang out and have some drink or a tapa or something like that. And that's and those were very important on the social relationships, which is very interesting when you think about from a classic nutrition epidemiology or nutrition public health person. So this idea that we have to ban everything that is unhealthy from our point of view without taking into account what does it really mean for the community. So we had a long discussion about why fast food places are important for underserved communities. And we had a long discussion in this idea that one family said, well, you know what? McDonald's or Burger King is fantastic for us because McDonald's offers me a safe place with reasonable music, it's clean, and I can spend my afternoon for $20 with my whole family. And nothing beats that. If you work 12 hours a day and so does your partner, and you have very few time left and money, that sounds like a very good place to spend the evening with your kids on Saturday. So this idea that no, that's horrible, you should not do that. Well, maybe there's a big reason why that exists. Now the question is how can we, or the question that I think about is how can we turn those places into healthy places from a nutrition point of view, of course.
Hi.
I'm sorry.
So I have two questions related to both parts of your presentation. So in your comparisons between Baltimore and Madrid, and also my thoughts were related to the fact I was raised here in New York City in northern Manhattan. So you stated that it's 70% access in Madrid to quality food sources versus 1% in Baltimore. What is the correlation between access to farms, nearby farms, in both those cities? I'm just thinking about issues with transport, getting food to the locations nearby, as well as so you spoke about people having a more of a tendency to go to the small businesses versus the large supermarkets that have more quality foods or higher volume of different types of foods. And I know here in New York, one of the reasons that happens is because there's more, kind of like McDonald's, kind of like the McDonald's scenario, but that your local bodega, for instance, is almost like a part of your family where, first, the pricing sometimes is also better, but that, you rely on those sources of food in the community versus the higher priced almost clinical kind of environment that you might find at a supermarket. So
Yeah.
I just want to know your thoughts on those two things.
Yeah. We wrote a paper that is not published yet on a qualitative analysis on food environment in one given neighborhood in Madrid, and one thing that came out very highly and was highlighted by the participants and the interviewees was the trust of the community in the store owners or the store workers in the area. So that was very high in the what we appreciate and what we don't appreciate, and why do we go to some places and not others. I think the same was in Baltimore communities. When I was working in Baltimore with colleagues in the Center for a Livable Future or with anthropologists in the nutrition department, same came out. Yeah. And the first question was about Madrid it's not so large of a city like New York, but they're not very far. We don't have a large amount of farms close to Madrid. So for us, it's absolutely impossible to relate to where do those tomato salad come from if it's not from very far away. So it is something that has started in the last, I guess, 10 years with CSAs and things like that, but it's definitely not a common possibility. How sustainable the foods are that are distributed and bought in Madrid, and how sustainable food systems are in cities. I don't know if that's where you were going. I think that's the next $2 million or $5 million question in terms of research, and we discussed a lot about that in Europe, specifically with people working on agriculture and distribution, and how. So it's not just how much do we pay or how healthy is the food that we pay in the city of Madrid. It's how sustainable is what we are buying and consuming, and that is a very complicated. But I think that's the next question.
You mentioned the system science and use of system science, the food and energy and water and all the systems together. Could you elaborate more on types of system science analysis you would do? Do you do mathematical modelings or conceptual models? And how could you see that in, for example, comparison between Madrid and here in New York City? How could we apply that as well?
You mean in terms of food systems? Yeah. No, I mean, like, I haven't done yet any type of analysis on food systems of a city. I would love to do that. I've been wrestling. There was a publication in Nature like 15 days ago or a month ago on how our current food system, how sustainable can it be in the future if most of the population in the world will continue the way that we approach food consumption and food production, and I think again that's the remaining great question is what can we do in terms of cities to answer that question, and I think that's a very complicated one that I would love to be able to answer you, but I don't yet. Maybe in 10 years.
Directly related to this question is the whole concept of urban farming. What are the attempts in Madrid to create community gardens or spaces where people can grow their own fruits and vegetables and not have to rely on food available to them through commercial outlets?
So far, it's very marginal, and there are some attempts, but I think the attempts so far in Madrid of urban gardening relate more of a way to relate to nature and get together, and are seen more of a social cohesion piece of daily urban life more than actual source of food. I don't think that right now in Madrid we have any plans, or maybe some civil society people have, or organizations have this idea in the future, but I don't see that by any means possible. In Madrid, we have one of the largest main food markets, like central markets. So the largest one is in Japan, and the second one is in Madrid, which is a centralized food market that opens the whole night to distribute food to the rest of the retailers. And I mean, it's like an airport. It's humongous. I mean, like, to think about that, the amount of food that goes through it every morning, every night, will be supplied by urban gardening, even like in a marginal percentage. It's not feasible nowadays.
The other comment relates to, are you one of our students commenting on Baltimore and the rural environment, rural outskirts? Are you one of our students? Oh, okay. Well, it's a shame. I would have then applauded you as one of our students for talking. But I applaud you anyway. I think that there is a very important distinction in terms of accessibility to peri-urban and rural environments contiguous to big cities. And within networks, especially within both middle and low socioeconomic segments of the city, they do have networks with surrounding, especially if they have family links, for example. And having lived in Washington, D.C. and the Baltimore area for many, many years, I'm fully aware that people would go out to harvest within family networks that are spread within peri-urban and rural accessible environments where they can get also fresh fruits and vegetables. So New York, again, is like Madrid, perhaps a little bit, where this is not so accessible.
Yeah. And again, those are questions that I think are very city-specific in the sense that, for example, in Barcelona, there's a side of the geography of Barcelona that there used to be a river, and now there's a lot of thinking about how can we turn that piece of land into a huge orchard that can be considered urban farming. For example, in Bilbao, which is another big city in Spain, there's a lot of urban farming or going into the outskirts of the city and everybody having a little piece of land where they relate and can farm. But this is definitely not the case in Madrid. Also, I think because Madrid is in the middle of Spain and is very dry, and yeah.
So one thing you didn't bring up is race and how race influences access in a highly segregated city like Baltimore. So it not only influences access, but also life expectancy. So can you talk a bit more about when you did your comparison between Madrid and Baltimore and how that, like, how you took that into account, and then if there's something comparable that exists in Madrid, maybe it's not by race, but maybe it's by immigration status. Yeah.
It's definitely a fundamental question in terms of inequalities and social determinants of health. Here in the United States, you have a long-standing history of looking at race as a determinant of health, of how race relates to health. In the cities, how much cities are segregated, in Baltimore being mostly black and white, with a growing Latino community right now, but it's still marginal compared to black and white communities. Definitely, when we did the comparison, we had that demographic in Baltimore, but in Madrid, it's very interesting. Well, in Spain, we don't even take into account race when we talk about census data, social demographic data. We take into account country of origin or immigration status or ethnic, but when we talk about ethnic, we mean about gypsy community, which is a very small community in Spain altogether, and in Madrid as well. So in Madrid, we will talk about income and educational differences in the city of Madrid. We do have some research right now. One of our students, Angelica, is here. She's looking at country of origin, immigration, what is the largest minority in the city of Madrid in relationship to the location in Madrid and in relationship to the development of diabetes. But again, immigration is a rather recent social process in Spain compared to the United States, and that's something that is very important for us. But again, in this case, we are looking at country of origin from people coming from Andean countries in Latin America.
Dr. Franco, thank you so much.
Thank you.
Thank you for the talk. Thank you all for your questions and attention. And there's still some food on the table. Please pick it up on your way out.
Thank you.